Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital in Melbourne, and today your host on the Kids Health Info podcast. At the moment on the podcast, we're talking about different conditions that bring parents and their children into our emergency department. And one of the most worrying things that you can see sometimes as a parent is a rash. And here to talk about when we really do need to worry and perhaps when things aren't so serious is Dr Fiona Reilly, one of our specialists from ED downstairs. Welcome, Fiona.
Thank you, Anthea. It's lovely to be here.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So I've got 4 kids, and I know even as a paediatrician, when I've seen them sometimes with a really worrying looking rash, you can feel a bit panicked.
Yes, I imagine that this is a really common experience for families, that your young child, usually your toddler, has been unwell for a few days with a fever and maybe other symptoms like a cough or runny nose, some vomiting or diarrhoea, and then just as the air seems to clear and you think finally you're going to get some sleep because they're getting better, they come out in a really worrying looking rash. And it's really difficult, we appreciate, for parents to know when that rash is a kind of rash that needs to be urgently looked at by a doctor or other health professional, and when that's something that you can watch and manage at home.
As you say, it can be really hard to know, perhaps just looking at the rash, whether it really is something that's a sign of a more serious illness, or, as you have just said, sometimes actually it's not so worrying. So how can parents tell the difference?
The first thing I just wanted to say is that when the illness is getting better, your child is starting to recover, their temperatures come down, their symptoms have improved, and then the rash comes out, that rash is usually a sign that your child's immune system is doing its job, that it's fighting off the illness. And this is very, very much the end stage of that illness. And so in that scenario, that's not a worrying scenario to me as an emergency doctor. But thinking about the rash specifically itself, we can think of rashes in 2 kinds. There are rashes that when you press on them, they disappear back to skin colour, and then they reappear when you take your thumb or finger off your child's skin. And you can do that anywhere on their body, but wherever the rash is, you just put some pressure on for a couple of seconds and then release it. So if that's a disappearing, reappearing rash, that's not worrying. That's not a rash that worries me. The other kind of rash is what we call a non-blanching rash, but what that means is that when you press on it, it doesn't disappear. It stays there, and it might be a slightly darker colour and the spots might be very small. But when you put your thumb or finger over them and put pressure on for a couple of seconds and then release, the spot hasn't disappeared, it's stayed there. So those rashes are in a different category.
And so doing that sort of test, if you like, at home to see if it blanches or not. Sometimes parents also might try doing that with a glass. We've certainly seen that. I know I've talked about that with parents before, but as you say, Fiona, you can also press on it and just see if it disappears or not.
Yeah, in terms of using a glass, you just need a small glass with a nice flat bottom, and then you can put that over whether that's on their arm or their leg or their breastbone, for example, and you can just put some gentle pressure on the glass, and then you can look through the bottom of it to see whether the spots are disappearing or not.
Okay, so let's talk a little bit about that serious situation when they're not disappearing. So a non-blanching rash, you've mentioned, is something that you might need to be more worried about.
Yeah, I think the first thing to say is that the vast majority of non-blanching rashes are not serious, and they can be caused by really common things like a bout of coughing, a vomit that's quite forceful, some rough and tumble play where your clothes get a bit caught up and pull on your skin. And so there are lots of not serious causes of non-blanching rashes. But right down in the smallest category, there are some serious causes, and those are infections caused by bacteria usually, many of which children are now immunised for, like pneumococcal disease and meningococcal disease. But if your child's unwell, if they're feverish and they have a non-blanching rash, that's a time when you do need to seek urgent medical review. And depending on where you live and what your situation is at home, that will be different for every family in terms of I live next door to a hospital or I live a long way from a hospital and I don't have a way of getting transport there. I guess the key thing to say is if your child's unwell, has a fever and a non-blanching rash, they need urgent medical review.
Okay. And when that rash happens, that non-blanching rash, what is actually going on in the skin that causes it?
Yeah, it's really interesting. In the skin, the reason that the rash doesn't blanch is because it's actually tiny, tiny little pinpoint spots of bleeding in the skin because the tiny capillaries get fragile when there's a serious infection or when there's increased pressure in those little capillaries, like when you have a really forceful vomit. And in that situation, those little non-blanching spots might be only from the collarbones up, and they might be most visible around the eyes in your child and the face.
And so the nature of the rash itself, as you've said, and also what sort of situation your child is in as to whether they're unwell or not, are clues as to what you need to do next. So we've talked about a non-blanching rash, particularly perhaps in a child who's unwell. What about what we call a blanching rash or, a more typical rash that does disappear when you press on it? And there's a whole variety of those sorts of rashes as well. Let's talk a bit more about those.
Yeah, there's so many viral illnesses that cause rash as part of the lifespan of that particular virus. And each rash has a slightly different appearance. Some doctors will know from the appearance of the rash. For example, one caused by a virus called parvovirus that causes very red cheeks in your child, slap cheek.
Yep.
It also causes an unusual sort of lacy pattern rash on your child's arms and legs. So some doctors might be able to diagnose the particular virus by the rash itself, but many viruses have a similar looking rash. And again, it's your child's immune system responding to the virus that gives you an important clue that actually their immune system's doing the job it's meant to do. It's fighting the virus off, and the visible evidence of that is the rash that comes out.
I think that's really helpful for parents to hear because as you sort of described at the beginning, Fiona, often if your child's been sick, they seem to be getting better and then they get the rash. I've certainly found that parents think, oh gosh, they're actually not getting better. They're actually getting worse. Now we've got a rash, as though things are going down the wrong path rather than, in fact, this is part of them getting better.
Yeah, rashes are so, they're so worrying and arresting when we look at them that we can think, oh, that's exactly what's happening. They're going downhill. They're getting worse. It's really hard to look at your child, their behaviour, their appetite, their level of energy, their level of interest in things like in things like playing, as opposed to just the spots. And we can get really distracted by the spots because they're so red. And when children get upset, when they're crying, when they get a bit overheated, the rash can look even more serious. But in fact, if we redirect our attention to actually what our child looks like, and I've been in this situation myself with my own kids, thinking, wow, those spots are really alarming, but actually she's sitting down playing with her sister and seems perfectly content. That can be a difficult thing to do, but we need to think about those things together. What's my child's behaviour like? Do they behave as though they're very sick, or actually are they behaving in a way that suggests that they're well, but they've got these very alarming looking spots? And so in that situation, I would recommend to many parents, don't leave the comfort of your home and organise care for your other children. We've got lots of virtual emergency services around Australia that people can access very easily and absolutely free of charge, that are often the fastest way to get a medical opinion about, is this a rash I need to be worried about or not? And one hot tip I would have for parents is that in a video consultation with a doctor or other clinician, it can be really hard to get the fine details of a rash. So before you contact the virtual emergency department, it can be very helpful to take your child to a place in the house where there's pretty good lighting and take some close-up photos of the rash itself, so that we can really have a good look at those to determine, is this a rash that's worrying or not.
That's a really great tip, Fiona, getting those pictures. And then, as you said, we've got the benefit of technology now with telehealth, that getting help from a doctor to understand, is my child sick or not, and then also think about the rash to decide, what you need to do next.
Yes, and for people who can't access that for whatever reason, there's also the urgent care centres here in Victoria who are very happy to see children with rashes and an illness to determine, is today the day that I need to go to emergency, or actually is it okay to stay at home?
Absolutely. And so a couple of other types of rashes. We've talked there about rashes with illnesses, like commonly viral illness, rarely a more serious illness. What about rashes in the setting of an allergy? Is that something that you see in emergency as well?
Yeah, we do see a lot of allergic rashes, because they can be something that comes up very suddenly and unexpectedly, sometimes for the first time that your child gets introduced to a new food, for example, like egg. And sometimes in children who we know already have allergies to various things and get inadvertently exposed to those things, like nuts. And so they can get a very sudden rash that looks really alarming. It's red and can be lumpy or itchy, or can be less lumpy but very widespread on your child's body, and that's called hives or urticaria. The rash in itself is really an indicator to us of what's going on inside your child's body, and so if your child has a rash that you think is a reaction to something that they've eaten or medicine that they've taken, it's come on suddenly and it's spreading quickly, and if it's associated with problems with their breathing, a change in their colour, vomiting, or you're worried, trust your instincts. That is a time to call 000. And the reason for that is that the ambulance paramedics carry medication that can be used in a severe allergic reaction, an anaphylactic reaction, to treat your child.
And there's also the less serious rashes sometimes in emergency, so aside from allergy and anaphylaxis, but another rash that sometimes brings families in is eczema, which is incredibly common. What sort of situations do you see with that?
We often see eczema in the emergency department in really small children, so babies under 1, where their skin is really sensitive and fragile, and when they get a flare-up of eczema, it can be quite serious for them. Your skin is an organ. It's part of your body's...
It's the biggest organ.
It's the biggest organ in the body, and it's a really important part of your body's defences. So when your skin is angry and inflamed and dry and itchy, it's a reason that many parents come to emergency if the eczema flare-up is very severe and they haven't been able to get on top of it with a plan from their GP, from their family doctor, or if they're worried that the eczema's become infected. And that can be hard to tell without a medical opinion.
Yeah, so we have some other resources. We've chatted before on the podcast, not with yourself, but with one of our dermatologists about eczema. So parents listening and thinking that might be relevant for their child could perhaps have a listen to that as well. So I think it would be helpful, Fiona, before we wrap up, to just talk about some of the common questions parents have about rash. So one of the really frequent ones that I know I've heard, I'm sure you have as well, is this rash contagious? does my child need to stay home from school or childcare, for example?
That's such a great question, and we often get asked that in emergency. When will my child be able to go back to school or childcare with this rash? For the vast majority of viral rashes, so they're the blanching, non-worrying rashes, once your child's better from the illness itself, so once they've had no fever for at least 24 hours and their other symptoms are improving, they can go back to school or childcare. The rash itself is not contagious. You can't catch the virus by touching the rash. It can look alarming to other people, and so some parents prefer to have their child's skin covered up with long sleeves or long pants, but the rash itself is not contagious. There's a couple of important rashes to talk about that are really contagious. One is chickenpox, and we're seeing a resurgence in chickenpox cases in the emergency department over the last 2 years as vaccination rates are falling. And so the little blistery, itchy spots in chickenpox are contagious. And so for that rash, your child needs to stay at home until every single last little blistery spot is fully crusted over, and that usually takes around 10 days. So if you have a number of children and it goes through the house,
unpleasant.
It's very unpleasant. It's a real sort of stay at home, stay away from other people for sometimes a few weeks.
Yeah, and it can take its time going through the household.
It can take its sweet time going through the house.
And so just another fortunately rare but very serious condition that can present with a rash. Let's talk about measles.
Measles has always been, in my working life, quite rare, but it's on the rise, and that's largely because vaccination rates against measles are falling. So what I'd say about measles is that it causes your child to be really unwell with the usual viral symptoms like a high temperature, a runny nose, a cough, red watery eyes, and then you get a rash that develops all over the body. So it is a blanching rash. It's not one of the non-blanching rashes, but it's a more serious one. And the main thing to say is that your child will be very miserable and look and feel unwell, not eating or drinking properly, not interacting with you in the way that they normally do. And so if you're worried about measles, and primarily the children that we worry about catching measles are the ones who haven't yet been vaccinated, so smaller children, children who've travelled overseas, because measles is much higher in many other countries outside Australia. So if you're a recently returned travelling family, or you've had contact with a known case of measles, that does put you at risk. Measles is one of the most contagious illnesses in the world. So in those situations, that is actually a great time to go virtually to the ED, so to use the virtual emergency department, because of the level of contagiousness of measles. What we really are hoping to avoid is families feeling really terrible after the fact when they realise that they've potentially infected an entire waiting room of other kids and parents with measles because they didn't know that that's what it was. So if you're not sure, this is a great time to have a virtual appointment, and they can then help direct you to the next step.
Yeah, and we're so fortunate to have things like telehealth or nurse on call. And of course, for families who perhaps can't access that, if you're going to see your local doctor, letting them know when you call to book that appointment of your situation and the potential risk if you've been overseas and your child has a rash, so that they can manage it safely in a different way.
Yeah.
So that actually brings us on to a really great opportunity to talk about preventing rashes. And we've talked a little bit about vaccination just now, Fiona, and I think it's really interesting to reflect back prior to really effective immunisation that we fortunately do have here in Australia now, to a time when rash actually often did represent a really, really serious illness. And I think that's often why particularly grandparents can feel really panicked and quite emotional about a rash when they see it on a child. But a lot of the serious illnesses that can show up with rash are largely preventable now from vaccination.
Yeah, that's so true. And historically, outbreaks of contagious illnesses with rash had, high levels of sickness. They went through communities. There were sometimes child deaths associated with them. So people had reason to feel very worried. And now we have vaccinations against some of those most serious illnesses like measles, like rubella, German measles is the other name for rubella, like meningococcal disease and pneumococcal disease. All of those things are now covered really effectively by vaccination. And so for many of my younger colleagues, they've never seen a case of one of those with a rash, which is a really amazing thing. I still remember from my early days as a doctor, young children with meningococcal and pneumococcal disease.
Absolutely.
Who were critically ill. And so it's really incredible to work in an era where vaccination has prevented so many of these diseases causing illness and sometimes death to children.
Yeah, so always we want to remind and encourage parents to keep up to date for their children with all the vaccines on the schedule so that we can do as much as we can to prevent these serious illnesses.
Yeah, and as paediatric doctors, it's part and parcel of our work to have conversations with families about their worries about vaccination, and we're here to answer all your questions. Like, there's no judgment. We really want to have that conversation with you to help with whatever questions are in your mind or worries are in your mind about vaccination.
That's right. It's about an informed decision for every different person and different child to keep them well and safe.
Yeah.
Another thing that parents sometimes ask, is there anything I can put on this rash to, help it go away more quickly, particularly in the case of a viral infection and a rash?
Yes, I really wish there was a magic cream that you could put on that would get rid of the rash, but sadly there isn't. So outside of eczema, which we've talked a little bit about already and which does need specific treatment with creams, viral rashes don't get any better, any quicker, unfortunately, with creams. So save your money. What I would say is that if your child's skin is really red and looks irritated, sometimes a lukewarm bath can help just to cool them down a little bit. Sometimes a wet washer to the face or whatever part of the body seems to be bothering them can make them feel a little bit better. But on the whole, most viral rashes don't cause itch and don't cause discomfort or pain, and don't need any creams or specific treatments.
If they are itchy, it's probably a sign that perhaps it might in fact be more allergic rather than a virus.
Yes, that's right, or something else like
chickenpox.
Yeah.
Thank you so much, Fiona. We've covered a lot there, and there's even more we could always talk about with rash because there's so many different situations where, as you say, the skin is another organ in the body, and if something's happening with your child, it might just be that in some way it shows up on their skin, and that's going to be a rash. So at the end of the day, looking at the child, considering how unwell are they, do you feel worried, and then what are your options to get them checked out if you need to. Thanks again for all that advice. It's been great to chat today.
Great to chat with you, Anthea. Thanks again.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.